Hi, I'm Dr. Julie Steinhauer, and let's talk about binasals. Now, if you don't know what binasals are, it's actually an application that you put on glasses that kind of goes down the center of the lens. Well, I should say like the middle, like in towards the nose, not the center of the lens. Let's just show you. So this is what a binasal looks like on a pair of glasses. Now we have a bunch of old style glasses from way back when from my old clinic. I've been doing this for a few years. And so I have a bunch of these glasses that we apply binasals to that work great for both our adult and our kid patients that come into the clinic. Now, what do you use a binasal for? What on earth would you do this? Why would you put this on glasses? What? All right, so binasals are used often, at least in our facility. We're going to use them for patients who have an eye turn in called esotropia. So if the eyes tend to cross in, what happens is a person will develop what we call cross fixation. Now, cross fixation is where the right eye, if it turns, sees over in the left visual field, and the left eye, if it's turning, sees over in the right visual field. We don't really want that happen. We don't really want that to happen. We want the right eye to be able to fixate over here and the left eye to be able to fixate over here in cases of esotropia where the eyes are turned and crossed. And so using a binasal is going to help kind of train the brain to be able to do that. Now, what's interesting is that whenever you apply these on, if they start to cross their eye, they kind of run into the edge of that to where they can't really see. So it almost forces the eye to kind of come out and away and pay attention to information over here, and on this side to kind of come out and away and pay attention to information over on the left side. What's great is that's the first step in starting to kind of train someone to use two eyes together as a team and not to overcross their eyes. Now, it's not the only thing. You can't just go out and apply binasals and think you're going to cure your esotropia. There are tons and tons of steps that are involved with teaching someone how to align and use their two eyes together with their brain accurately. So it's not just this, but this is a step, and it's a super important one. Now, do we ever use it for anything else? Well, every now and then I have a patient who has an ExOtroPia, which is an eye turn out. And in this particular case, the binasals work great because literally they kind of are like, what is this? And they'll cross their eyes in to look and see what's in the center, and it teaches them how to cross and converge their eyes better. So binasals can be used in several instances, and there's more. But those are just two of the most common reasons why we use them in our clinic. Now, if you are thinking, would that help me? I have an esotropia, or I have a squint. I have an eye turn in. Could that possibly help me? Well, the answer is probably yes. Absolutely. Contact our clinic, though, to find out, because there's a lot more to it than just binasals. So contact our clinic at visionforlifeworks.com. You can fill out a questionnaire, which will kind of kick over to us, and then we'll be able to connect with you about how we might be able to help you. Or if you're local, then obviously just pick up the phone and give us a call at 618-288-1489, and we'll talk to you about not only binasals, but all the other cool stuff that we do to help our patients with strabismus or eye turns learn how to use their two eyes together as a unit. Thank you.